Hello everybody, we have a few patients in this compilation for you today. So this is starting off with myself. We've got what looks like a really soft kind of a bit of a mixture of like skin and wax, but it's actually not.
No, that's deceptive, isn't it? It did look really soft.
It looked really almost wet.
Yeah.
But it's like super crumbly. It's a really weird kind of consistency. I'm right at the entrance here as well, which is why there's like a couple of hairs that are just flapping in front of the camera. So we're just trying to loosen this off the ear canal, just doing that kind of peeling motion. And then as soon as we start getting it detached, we're going to give it just a little bit of a wiggle, and that should loosen up those deeper parts that it's anchored by. Seems to be coming out okay so far.
Yeah, looks good. Oh, that's a nice big chunk, that one.
Is it? Oh, it's quite long as well.
Yeah, look at that. That's a beastie, isn't it?
That's a good one. What have we got left?
Oh, quite a bit though.
Yeah. It's a bit of an awkward, kind of position to go into as well. I think there's a bit of a bend, a bit of a dip in the patient's ear canal. So here we go. We got a.
That's a good chunk.
Yeah, we got a good old wiggle going on here again. There we go.
Look at that.
It's weird. It looks really soft, doesn't it?
Yeah.
It just looks really soft, and it's absolutely solid.
It's coming away nicely though. It is coming away nicely.
They're up and down in those ones.
They are. Yeah, you know, because you never know. Because sometimes you'll hit like these really hard patches, and then you hit a really soft bit further in, and it goes really mushy, doesn't it?
Yeah. That should be the last. Oh no, it's not. I can see a little bit there.
It's a little hidey bit in the corner.
This should be the last bit.
Dense but fine, fine dense hairs though, isn't it? Or densely packed fine hairs. That's probably a better way to describe it.
You've got it. Lovely looking eardrum though, nice and healthy. Textbook really.
Yeah.
Nice and shiny, nice and pearly. We've got a very similar story here. It's not completely blocked up. You can see there's a little gap above this, but it's very firmly packed in here. The reason I'm not really putting oil in at the moment is because of all this hair near the entrance. Now we could, mop a bit of it up, but
it always collects though, doesn't it? It just coats those fine hairs, and as soon as you pass over them, it ends up misting that camera straight away. Oh, building the grip there.
Yeah. Oh, there it comes. You can always just see when that whole thing is starting to peel away. What was I going to say? Completely forgot what I was going to say. I just went blank.
Do you say this patient? I can't remember whether you mentioned this one uses sleep plugs.
Ah, yeah, that's right. Yeah. So that's one of the reasons that obviously this is not coming out by itself is because the patient wears sleeping plugs every night, but also has an issue with wax, which putting the two together doesn't really, you're not going to get much out.
No.
Patient could have used a little bit of oil just to keep it nice and soft, or softer than what it is now. But we obviously would have recommended a regular follow-up, a regular checkup, sorry. So a lot of patients generally are between 6 and 12 months, coming in every 6 and 12 months. But yeah, I would have said about 12 months would have been absolutely fine here. Looking at how much we've removed, there was quite a lot in that one side. Mind, there was quite a long piece.
It was, yeah. I mean, this one looks. I don't think this one's going to be quite as long.
No, it's just going to be like a thicker.
It's whether it comes out as one big plug, because it almost looks like it's all interconnected towards the end, doesn't it?
Yeah, it's getting it past that narrowing near the entrance here. You can see it's almost like on a bit of a slant as well.
Oh, it's there.
I'm like, come on! I can see it. I can see it's about to come out. I'm like, come on!
I think that brought. I think. Oh, that's quite. It's almost dusty in the middle, isn't it? It's really dry, that centre section.
This is the back end of it now.
Is that going to come away?
Now we got a little tiny bit there.
Oh, I don't know. I think most of it's come away. There, looks of it. I'd be interested to know whether that back section actually came with it.
Gosh, it's really tricky. Sorry for the vision, guys. I can't go any closer because my camera will be pretty much right up against this skin. But these hairs, I had a really. I actually had an appointment today that I had failed.
Oh, never.
Yeah.
Oh, why is that?
I was just hair hair, but it was all like
the clipped hairs, like the loose hairs, or
I assume so, but there was a really teeny ear canal, but it was all stacking and like really thick dead skin right over the front of the eardrum.
So it almost goes like that mesh over the front. Then it's really difficult to get through.
I just couldn't get it. I tried everything.
The thing is, no matter what you put in there, especially if it's right up against the drum, suction won't get it out. You might be able to irrigate it out, but
it's a tricky one, really tricky one. So we got 4.5 centimeters there, so we've got quite a bit out of those ear canals.
That's 1 3/4 inches, that is there, guys. So this is actually my patient now. So the title for this one I put on is just dry wax and skin. It looks like quite a deep section, probably cotton bud use. I'm looking at that. There's a central depression right in the middle of that wax there. So just probing the outside edges, looking for any looser pieces to take away.
Yeah, you just kind of hope it's just going to loosen up all the rest of it. The whole thing comes out perfect.
It's just that edge there is coming away quite nicely, but it's not taking the whole thing out. I was really hoping it was going to just detach all the way down from that left-hand side right one, but you can see how far back it does actually go pretty much down to the drum, and you'll see that very thin, almost wispy skin sitting behind it was just attaching to the back of that plug. Let's try a set of forceps. I was going to say, that looks perfect there, that little edge. If it holds, because it looks a bit on a, you can see I've had to shift position there. I thought it was going to go, so I've dropped a bit further back. Nice. Yeah, it just peeled down from the top, but I think that central kind of core of wax that was sitting in front of the eardrum, I think that's still there. Yeah, there it is. That was quite a bit down there, isn't it? Yeah. And it is really firmly attached down there as well. You can see I'm struggling with I don't know whether it's the shape or whether there's an attachment at the back end. I think it's attachment. If you look to the right-hand side, see how that very thin skin is just peeling up into it? There we go. Oh, look how shiny that is. I know. Oh, there we are. It's looking a lot better now. So I'm just tidying up this one edge, just coming down. You can see this very, very thin skin. I know we say it a lot, but definitely using, the patient using some olive oil in here as well. Weirdly, this morning we just had, we basically sell the spray olive oil here in clinic, and always check the small print of the straight, because we've always used, we've used the same manufacturer for a little while, and then we switched manufacturers recently. We tried a different one, but I've only just spotted that they actually used to be with the sprays, you could use them as often as you wanted to, as long as it was within the expiration date. Oh yeah. But this other manufacturer that we've now got, it actually says on there that you can only use them for 28 days past first pump. So you have to throw them away after 28 days. Yeah, so always check your small print when you're buying these things, guys, because we recommend you're using them on a regular basis. And, they'd changed that without us knowing. And it was only an eagle-eyed patient that spotted it, so I didn't realise they'd done it as well. So yes, it's so always check your expiration dates on there. Don't just look at the one on the bottom, look at the small print and see how often you can use it, or when you've got to throw it out after your first use. Always check that one. A lot of the dropper bottles are 28 days, which is
I was going to say, I wouldn't have thought with the sprays though, because it's like sealed. It's like sealed, isn't it? Yeah, this is what I thought. But it's I've only come across, this is the only manufacturer of the spray, because there's only two that I really know of that do the sprays out there, and there's only one of those two that I know doesn't stipulate that, but the other one I've just found out today does. So yeah, there you go. Interesting. There you go. So we just get a bit of oil in there now. I know, look at that. Speaking of oil. I know, yeah. There you go. So out, this is starting to come. Look at that for a wiggle. Oof. Same kind of story here, really holding on to that back section of this plug. Let's pull this down. Oh yeah, there's something holding that in, isn't it? Oh yeah. There's something there. It's usually just that. It's usually the thinnest piece of skin, isn't it? It just anchors it. Which is actually the strongest. So this is the Rai in here now. Not Rai Hook. Just taking this away. Nice. Looks nice and healthy. There we go. That's the piece of skin that was holding everything in. So you can see I've just... Look how far back that's attached. That's pretty much attached to their boots. It's going so far in. But yeah, scratching the tongue. It is, yeah. I give a tickle on that one. But look how thick that is. It's going kind of around the one side. I'm trying to wrestle with it here. I'm lifting it out because I was going to say I'm probably going to forceps. No, it just doesn't cut in. And
the difficulty is if you try and do that with or try and pull it out with the standard sized Zoellner tube, it's just going to squeal like Billy O, isn't it?
It's just going to whistle quite a lot, yeah.
There we go, look at that.
Oh, that definitely wasn't going anywhere with
that,
the fine end.
That was definitely not going to come out with the fine end. I had to fight that. Look at that section, that last little section was the bit that was going up to the right-hand side. But eardrum looking nice and healthy. I know, it makes it look big against the skin. We know what we're doing. So 2 inches worth of wax and skin on that one, guys.
Yeah, 5 and a bit centimetres.
Well, guys, thank you so much. Oh, hang on, there's one more.
Oh, no,
I didn't realise it was the last one. This is yours.
Thank you so much for watching the last 3 patients. Stay tuned for the 4th one.
I didn't think there was another one. Yeah, so this is, I think this one's yours. I think is normally, if there's 2 I usually start and finish with the same one, so this is going to be yours. I think this was the cotton bud one.
Oh, I'm only saying it like that because these have been filmed, a few days usually previous to us talking these over. And I can't remember this one. We've had really busy days. Yeah,
oh, that's been mental.
Oh my goodness! Well, that's come away nice and easy though. Like a nice big dip going down to the in the recess towards the eardrum there though. So we've got a very similar case. You can see this one's been oiled.
Yeah.
But the other one wasn't so much oiled because the patient didn't actually feel there was as much of a problem on the other side. But you can see this one is a bit more. Well, with the use of the drops, this has softened up quite nicely. What you generally tend to get when we say it's cotton buds, when the wax is dry, it can cause a lot of pressure in the ears if it's been, compressed quite a bit. But just don't do it to yourselves. Just don't do it.
It's not big and it's not clever, guys.
No.
Just tidy up with the fine end,
just hovering here, God, I'm always like, again, I know I keep saying it, but I'm like constantly aching from the gym now. So like every time I'm doing a video, I'm always looking like I'm shaking. Oh gosh.
It's because the guns, Taylor Green. It's the guns.
I'm trying to work on it.
So 3/4 of an inch I'm going to go on that one.
Just 2 centimetres.
And guys, that is definitely the last one now.
Definitely.
So thank you very much for watching all of them. And guys, if you do enjoy the videos, you can always like, heart, share, follow, and subscribe for me. If you thoroughly enjoy the videos, you can always become members of the channel as well. That way then you get to see even more videos every single week. We're back with members video tomorrow, so we'll see you tomorrow, members. But as always, guys, take care of yourselves.
Take care of your ears.
And take care of one another. And myself and the lovely Mr. Taylor Green. We'll see you again real soon. Bye, everybody.
Bye-bye.